How are we all doing? All right? Everybody had a caffeine shot this morning? Nice wet day for FILEX. Probably better off being indoors early. All right, guys, we're going to kick off this morning with a fantastic start to the day with Tim Keeley. Now, Tim's got over 12 years' experience. He's the principal physiotherapist at Physio Fitness in Sydney's Bondi Junction. He also is the owner and director of Physio Fitness in Australia. He works out of 4 of the Fitness First health clubs, pretty much bridging the gap between the personal trainer and the physio. He specialises in back pain, sports fitness and training injuries, and places an emphasis on corrective exercise techniques. So over the next hour and a half, you're going to see some really good stuff, some really good practical demonstrations by Tim. So let's give Tim a nice warm FILEX welcome. Tim Keeley.
Can you hear me on this? Thank you very much. Welcome back to FILEX for the second day and this session on strength essentials. I'm pretty excited to see you all here today and a big crowd because this is what I'm passionate about. And hopefully it'll give you an insight into either your own back problems or your clients' problems, what to do, what to stretch, when to do it, what exercises to do, but also how important it is for you guys in the instruction and the technique of these exercises. So you are doing rehab, you're not just doing general training exercises with these people, and you'll realise that that's the difference between doing average rehab and really good rehab that gets these people right. Today it's a big session. We packed it into 90 minutes. This session I wanted to really be a 3-hour workshop. So what I will be doing is this session, if you feel like you need more practical work, is doing a 3-hour workshop on this. There's a piece of paper floating around. If you put your name and email on that, I'll send you out the handout because it's changed a little bit, but also give you some updates on when we're doing that workshop and that sort of thing. So can I just ask today, how many people in here are exercise phys and personal trainers? Just about everybody. Great. And how many physios came today? Oh, good. That's great. So that's good numbers. Well, let's get stuck into this today. What we're going to talk about today, we're going to keep it pretty specialised, not talking about generalised back pain. We're going to get down to the nitty-gritty of 3 things that I find in the gyms, in the fitness world that are quite a bit of a problem that people really struggle with. The first is that hyper-lordotic kyphotic syndrome, which many of you may have. The second, people who've had disc bulges or full-on herniation, prolapses in their lower back. And the third one we're going to touch on is the SIJ and that no glutes type syndrome. The stuff we're going to cover is a lot about the strength side of things. So I'm going to not skip over, but we're not going to go in depth about the activation of the core. A lot of it's been done this weekend. Some fantastic stuff by Barbara Hungerford and Paul Hodges. And hopefully you've been to those lectures and got some idea of what to do with that. We're going to touch on a little bit, but it's more about the strength side of things. So when you get these people training, what do you really need to focus on to get these people post sort of pain and post getting their core going to actually being able to train properly and play sport. And as I said before, the technique and the instruction is the most important thing you've got to take away from today. And it's only part of the problem. Strength Essentials is only a little part of the problem. You've got to put it into your program, your rehab program, and make that part of a whole thing to help these people, because everyone's a little bit individual. You can't really just take some exercises and put it into everybody. So you've really got to screen these people first, make sure you get a good assessment or advice from your physio if you're a personal trainer about exactly what that problem is, when to start these exercises. Otherwise, you're sort of blanketing people and putting everybody in the same category, which you can't do with lower backs. And we're not going to really talk about the treatment side of things. For the physios in the crowd, they sort of know what they do as far as the acute side of things, and we're not really going to touch much on that. It's more about what happens after that. Okay, first thing I want to talk about is what happens when people get injured in their lower back or the SIJ, and the pain that happens. Just a few issues that you've got to understand what happens to these people when they go through it, because when you're rehabbing or when you're training them, you need to understand what has gone on in the past that now you're battling with in the present and trying to change. So the first thing, when people get pain or an injured disc or injury to their lower back, you've got to think, what is happening to their core stability? It's going to start shutting down. And if you've been to those lectures yesterday, they talk about pain and reflex inhibition, so the messages going back up to the spinal cord and deactivating muscles, especially your transversus and your multifidus, those little muscles that control that stability of the spine, give that spine a nice flexible movement so the big muscles can move you around. And remembering that, very quickly after a significant injury to the lower back, those muscles start atrophying and you've got to build those back up. Second thing, the changes that happen. So once you've got that inhibition or that shutdown of what's happening in the lower core, you go to that global muscle pain, that compensation. The body's very clever and dumb at the same time. So it'll go, right, let's do whatever we can. I'll switch on some other muscles to try and stabilize him because he wants to keep walking and keep moving. That's a short-term solution. Unfortunately, long-term, that starts turning into problems, and it's where you guys usually see them. They've still got some of that patterning problems present, and you've got to try and break that mold and change that person, restore the balance back. What happens to the lower back? Most of the time, you'll get people who've had back problems, like the hyper-lordotic people, will have overactive lumbar extensors. So the multifidus is maybe not working so well. They have to compensate with their lumbar extensors. That also might be because their posture is not right, so they're doing a compensation pattern because of their posture. Their QLs start kicking in, the obliques start kicking in to give them that bracing effect, give them that support that they need. And these muscles sort of try and make up the stability, but they're not really designed for that. They're designed to move the body around, not to be tonic and stable. That's the job of your transversus and multifidus. So these muscles start fatiguing, they start getting very tight, and then they lose their function of what they're supposed to do. People start adopting patterns like bracing, the pushing out sort of feeling, that boxing of their thorax, which mucks up their breathing patterns. If their diaphragm, their pelvic floor are not synchronizing together, you're not going to get that ability to create pressure in front of your spine and support your spine when you're going to lift a weight. So these people have these little changes that slowly turn into big changes. They go back into the gym, start lifting weights, and they compensate for a long period of time, and then they start breaking down, start getting pains back. And then they think it's gym's no good for me, exercise is no good for me because it makes my back sore. And then they're in real trouble because the exercise is what's going to make them better. They haven't corrected their problem. They've compensated. They don't really know that they've compensated. And if they haven't been assessed, you guys sort of don't really know if they've compensated, not unless you get down to the nitty-gritty. And then they start having pain. They'll stop training or they'll stop exercising. And you're back to square one again. So very important that you understand that those things happen to these people and understand that these are the things we've got to get right. Not just making them strong and getting them back to exercise. So in the end, they lose that lumbopelvic stability. So the stability between their lumbar spine, their pelvis, they start losing. They'll have to compensate. Muscles start getting tight. Depends on the posture, depends on the problem. You'll see soon whether it's their hamstrings, whether it's their adductors, whether it's their glutes max that gets tight. Muscles start deactivating. Hip stabilizers, your lateral rotators start deactivating. And you just slowly get postural changes over time. Some are very rapid. Some people come in with a disc problem, they can't bend forward, and then they don't bend forward for 3 months, and then they won't bend forward. And they'll sit poorly, they'll have that pain avoidance where they'll stay away from pain. So when they exercise, they adopt the same patterns. They don't, they try to deadlift, they don't do it properly, and they start getting real issues. You can get tilting of the pelvis, anterior, posterior, lateral tilts, and they end up getting joint stiffness. So when they come into the physio clinic, they've got pain, their joints are all tight, their muscles are short and tight, they've got muscles deactivating. There's a whole complex system going on there. It's not just, he needs to get back in the gym, we need to strengthen up his hammies. There's a lot of things involved. So you guys as personal trainers must be aware that you try and get a physio that that is understanding what's going on, is giving that person treatment, and you can talk to and work with. Because a lot of the time, the physio is sitting on one side, doing all the acute stuff, even the chronic work, getting that person out of pain, teaching them the low-level activation work, teaching them what stretches they've got to do, teaching their postural changes, how they've got to stand, how they've got to sit, all the little boring things that we love and you guys hate, and the client hates. And then you've got personal trainers over here, which the client then is, wanting to go back to training, and the physio has got to, make sure that they know enough as far as the exercises, what they need to do to get that person up to speed to be able to train. And the trainers need to know enough about what the physio does and what pain does and why they're doing those exercises, because usually those exercises that we go through, they have to go through that program all the way through. You can't just sort of go, oh, yep, you've done your physio, let's do, normal training. And if you understand more about those exercises and why you're doing it, you're more likely to keep it in their program, because that's the secret, is keeping those exercises going on and on and on, but trying to make them less and less boring. Okay, so we really got to hit that reset button and restore this person. Now, with every one of these, the 3 things we're going through today, you guys have got to understand that this list is what you have to do. And we're going to work out how to do it with each individual one. If they're stiff, we've got to get their range of movement back, first up. We've got to get their flexibility back in the muscles that are tight or shouldn't be tight. Their activation's got to be restored, whether it's transversus or multifidus, or whether it's their glutes activating, whatever the problem is, you've got to get that going and work on their motor control. Now, the motor control is a hard thing. Paul Hodges talked about that yesterday. Getting this brain, talking to the muscles is a very difficult thing to get going. There's specific exercises for that. If you're not good at it, you need to refer that on. Making sure their postural control and their spinal stability is correct with every exercise that you do, with every movement that they do. When they pick up the washing out of the washing machine, they put it on the line, making sure that they've been taught how important it is to get that posture correct. When they're sitting, when they're standing, when they're running, when they're playing rugby, these things have got to be taught to these people. It's your job to be able to do that, because there's no point you doing all these exercise and strengthening and they have no idea where their spine is supposed to be when they lay down a scrum. So you guys are going to understand it's a very big, long continuum. It's a long process, and you've got to be on board the whole way. Their functional movement patterns, so learning how to squat, where they're supposed to be, try and teach them, get out of the bad patterns, get into the good patterns, knowing yourselves exactly what is a good squat, what is a good deadlift, what is a good lunge, okay, and getting really, really specific with it, because that's how you'll teach this person to do the right exercise, and then repeating it, they'll remember that exercise, and then next time they go and pick the bike out of the car, they're not going to hurt their back again. Then once you've got that organised, building into the strength, so of increasing the weight or increasing the reps or increasing the resistance, to try and get the muscles actually stronger, because the stronger your muscles are in your core and your limbs, obviously the better you're going to be. And trying to work on that dynamic movement, okay? It's all well being nice and stable in a squat, but they've also got to, if they're playing sport, move around, okay? So they've got to be practicing those drills and getting those drills correct to make sure that their dynamic control of their spine is as good as their static control. And then building on some endurance, okay? So doing 3 sets of 10 for some sports and some exercises, and like marathons is not going to be probably long enough, so you have to work on longer sets, longer endurance, teach them what they've got to be doing for a longer period of the day, okay, especially tonic muscles that last for a low level all day, rather than phasic muscles that last for a very short time but have a high level of activation. And then you guys working out how many repetitions you've got to do, the time frame, educating the time frame of how long these things take, and continuing it, like I said, into your program, keep it going. And the secret, just reverse all the problems that they've got, reverse them all, and get them back to normal, and then you'll get some good goals with that. And make a plan. Everyone's individual. Okay, you've got to work out what their physio assessment is, what their problems are, a list of all their issues they've got, and then you've got to create exercises and get stretches going and get them on board to make a plan for these people and have that plan progressive. Okay, don't just do a few exercises and then flag it and go to something else. And like I said, we're trying to bridge the gap here. We're trying to get personal trainers and physios together. It's very handy if you've got a physio in the gym, because they usually know what they're doing as far as training. And that will make that success from here to there. So if you can do that, you'll do well. All right, let's get stuck into the first one. Hyper-lordotic cathodic. This is me. Does anyone know that they're like this? Yes, no, not sure. Okay, these people, and I had a real issue with this a long time ago, and it's taken me a very long time to get this right and learn exactly what to do with it, because no one was really telling me what to do. They said, oh, you stick your bum out. Well, that's great, but what are the things I need to do about that are? And I remember as a kid, I used to be a runner my whole life, and my friends would say, stop running with your bum out. You look like a poof. What are you doing sticking your bum out? And I had no idea that I was doing that. I was wondering why my back got sore every time I ran. I just thought it was weak. And, I always sort of had this sort of posture like this. And every time I'd be in a CD shop, I'd look down and my back would be sore here. And that's when I started going to the physio, and he cracked my back and, gave me a few stretches and things. But I was 16. I didn't really take on board what I was supposed to do, and then off to uni, and then you finally learn out what's wrong with you. But these people are typically got pain. You can really put these people in a category. There's a few differences on either side, but most people have pain standing for long periods and running. If that's you, this is maybe what sort of syndrome you've got. And their posture is where they have too much lordosis in their lower back, too much kyphosis in their thoracic. Okay? And people walk around all day like this, and they have no idea that they're looking like that. All right, sticking their bum out. And these are the sort of people that you've got to correct their posture, one of the biggest things. And it's very hard, and strengthening is one of the major things that you need to do about it, and I'll talk about why. What you've got to also realise with these people, we'll look at our squat in a moment, is the extension that you see, okay, in a spine does not replicate the extension you see. That's not a very good picture because there's a lot more muscle bulk here than this person's got. It's not the same curve that you see on a human when they're standing because it's made up of muscle and tissue. Okay, so the normal spine is supposed to have this nice lordotic curve. Now, if you try and replicate what you see in a spinal model to a human body, you're going to do too much extension here. Okay, so it's actually just a very, very shallow curve. So if you see people that they've got a big curve, well, they're hyper-lordotic most of the time. And they look like they're sticking their bum out. And if you change it over time, then you'll see that they can get back to neutral. But sometimes it's very difficult for these people to do that. They have tightnesses just about everywhere. So if I'm in an anterior tilt, I'm going to have tightness in my lumbar extensors and my QL. So they're going to be tight. They're most likely going to be very short. I go in anterior tilt, my hip flexors are going to be very tight as well. So you can start working out what you're going to start stretching. Yep. My hamstrings, when I go forward, they go, oh God, my hamstrings are tight. My hamstrings are not short. Okay, because I'm in an anterior tilt, my hamstrings are long. Okay, and the biggest problem with these things is people go forward, they go, oh God, I've got to stretch my hammies. And they stretch their hamstrings and make them longer and make their stability worse. It's a temporary fix to the hamstrings, they sort of feel a bit better, but their back starts aching and they don't really know what to do. When they work on a lot of abdominal stuff, they'll find it very difficult to work on abdominal work because they're in so much lordosis. They'll find they're actually very weak in their rectus. Their transversus may or may not be working efficiently, most of the time not working efficiently because they're in that distended position here. Their rectus abdominis is very weak, so sit-ups are very hard for these people. They go, oh God, I can't do sit-ups. Right? And their back muscles are huge. So their back muscles are not weak. The cross-sectional area of these people, usually the back muscles, your extensors, are very strong. They're too strong. They're too on. So they're overactive. So you'll get weakness in long muscles. Their hamstrings are going to be very weak. Okay, you'll get weakness in tight muscles as well, like your hip flexor. And their glutes, sometimes not so good, sometimes good. My glutes weren't so bad. I've seen other people with hyper-lordotic syndrome and their glutes are shocking. So everyone's a little bit individual. So that's what you've got. Does that sound familiar to some people? Yeah? So what are we going to do? Again, push that reset button or push that restore button. We've got to get their alignment of neutral better. It's all well and good just going, okay, you've got to stand like this. Okay, but they can't stand like this all day. All right? They've got to start getting some strength back in the muscles that are weak. They've got to get some flexibility back in the muscles that are tight. And for these sort of people, you've got to look a little bit higher up as well, because their thoracic kyphosis has been like that for 20 years. They've got to start getting some extension here. Otherwise, they're going to fix this and be like that. Okay, so you've got to get this point right as well. And there's implications for neck problems. Making sure their inner core's working, their glutes, things activating, correcting their movement patterns, obviously. When I go into deadlift, I don't want to be sticking my ass out. Okay? And that's what they do. The extensors kick in, their hamstrings are weak. So as soon as the load goes on, the brain goes, hamstring's weak, can't do that. Extensor's really good. Okay, I'll do that. Unfortunately, that jams you up in your facet joints. At overactivity in your extensors, you get fatigue. And the pain is very broad. It's a fatigue pain. It's very common when you're running, because they're running in this position all the time. They haven't got their limb muscles controlling their pelvis well enough. Remember, core stability is about having segments nice and stable so the spine can move. All right? But if those muscles aren't moving that spine very well, then you get compensation patterns. So big one for this one, hamstring strengthening. If you're going to do one thing with these people, strengthen their hamstrings up and they'll be 50% better. And getting their core strength relative to leg strength. All right? Some of these people, they don't have enough stronger legs, and the secret for lifting is strong legs. Okay? Not just a strong core. Because if you have weak legs with a strong core, when you lift, you'll use your core too much. The stronger your legs are, and to get strong legs, you need a good core. So strengthening up your legs over time, the correct way, is a very good way of getting that whole system, that complex system of motor control and getting the body connected, going well. So what are we going to do? Key stretches, QL lumbar extensors. Now, if I can show you guys, some of you people, if you can't see, just stand up. All right? The QL extensors, for these people, they'll love the stretch. They'll hate it to start with because it's so difficult. So these people, remember, most people do this, go, yep, stretching my hamstrings out. That is going to be no good for people with this problem because you don't want to stretch your hamstrings out. Yeah? So you've got to take your hamstrings out of the equation, bend your knee. And they'll get to this point, they go, oh my goodness, that's really tight in my back. Okay, and they start off because they haven't done the stretch before. They're so short in here, they just simply can't get into lumbar flexion. But over time, this is going to be one of the most relieving stretches they can do. They've been standing all day, they go home and do the stretch, they'll feel magic in the morning. All right, so when you're getting these people, making sure, and like I said, these exercises are going to be on our website, but getting that knee bent and then getting your body down onto that thigh and keeping it there. So when they straighten their leg out, they can only straighten as far as you can keep your chest on your thigh. And once you get to that point, you'll probably find, yeah, I can feel that. And then you try and get one side stretched out more than the other, so you can do this both sides. And some people who are really tight will have this knee way up here. Okay, so you get that knee down over time, put a bit of pressure on there, which will give you that stretch between your pelvis and your spine, and then trying to get around 90 degrees and coming over that way. All right? One of the most key stretches you can do for these people. And remember, taking that hamstring out of the equation, make sure you stretch that lower back. And these stretches have to be 60 seconds at least. Right? You want to make some change and some creep in these tissues, you've got to get the stretch long. It can't be just a 5 or 10 second. It's not going to make any difference. If anything, doing stretches for a short period of time actually winds up the activation of those muscles. So they stretch too short, they'll get tighter. They've got to stretch for a long period of time to inhibit those muscles. Hip flex is very important. Why? Because we're in anterior tilt. Okay? So making sure with your hip flexor stretch, you're not doing any of this. Because I'm in lumbar extension. Okay? So I've got to get into neutral, and I've got to use that buttock. And they'll find that quite hard if they're one of the population that doesn't have the glute that works very well, because they haven't got the power to, and they haven't got the hamstring strength to actually pull themselves back into neutral. So they may have to start right back here. So there's not so much tension on here. It's very easy to do. And as they get stronger here, when you're strengthening them up over the months, they can start moving forward, but they've got to maintain that neutral, and then they'll feel that stretch going on. Same with rectus femoris. Remember, rectus femoris is a hip flexor. And a lot of the time they find, yeah, my hip flexors, they're fine. But as soon as they try and get any sort of quad stretch in that position, they really struggle. So making sure when you're getting these people that you do the same position But you also get here, making sure they don't go into that position. Okay, they've got to be in neutral, and that's quite hard. You may find that they really struggle with a quadricep stretch initially, but perseverance, you'll get there. Thoracic extension over the foam roller. Okay, on-offs, on-offs over the foam roller. Lying on that foam roller, which everyone usually loves these days. Okay, making sure they're long ways. Very good way of teaching them to get out of that lordotic posture and get back to neutral, because they're lying down, the gravity's off. Okay, they can push through your heels and teach themselves where they've got to be. If say I'm lying on a foam roller, we don't have one here today, but you know, they've got to make sure, if I'm on a foam roller, they don't arch into extension like that. So teaching them being in that position will help, one, loosen them off, but give them that feedback of where they've got to be in that position. And again, you know, that one needs to go for about 10 minutes if they can tolerate it. Pectorals, of course, that's a great stretch for doing pectorals, just lying there, doorways, rolling one leg over, whatever suits you. And if you're like me, I always have to stretch my adductors, because they're the muscles that have been compensating, trying to hold my pelvis tight, because my hammies haven't been doing the job. So at the top, most important, working your way down. Okay, you may find some people, you do that stretch, oh, they're fine with that, because there are some populations that, you know, they'll have certain things but not others. And like I said, everyone's a little bit individual. But start working on those. With those people, find the stretch that's tight and get it right. Right? Yes? If, yeah, you're trying not to. You're trying to strengthen your hamstrings in these people. You can stretch them if they become stiff from exercise, but you're not stretching for length. Does that make sense? You can stretch them, warm up, that's fine. But don't aim, because what they think is they're tight, they're short. Oh, I've got really short hamstrings. And they don't have really short hamstrings, they've got a really inflexible back. Okay, so they get down here, they hold themselves. You try this, you guys hold yourself in extension, you can only go so far, because you run out of hamstring range. And you go, oh, my hammies are tight, and if you just let go, but they can't let go. They've got to be taught to let go through strength and exercise and stretching and motor control. So, the essential things with what you're working on your core. If you guys went to those lectures yesterday, you're thinking about transversus, your pelvic floor, your anterior pelvic floor, your diaphragm, your multifidus, making that nice cylinder to keep, you know, working on the pressure changes to protect the spine, keep it stable, allowing it to move with the big muscles. Most of the time, these people, if they've gone into this lordotic pattern like this for a long period of time, they haven't been able to keep that neutral. If they don't keep neutral, those inner core muscles are not going to be very efficient. Now, if this isn't very efficient, most likely the time they are in that position, so their breathing, their pelvic floor is not going to be working correctly either. Some people it is, but for the people that isn't, you've got to work on it. And it's just getting their pelvic floor and breathing correct. I'm not going to go too much in today because that's a whole other day. And if you're unsure of working on how to work on pelvic floor and breathing, you need to go to a workshop on it and get it correctly right. One tip I will give you today, though, is when you're training, trying to make sure that they breathe out on the exertional movement or against gravity. And when they breathe out, that's when they need to be activating their pelvic floor to give them that transversus activation and give them that airbag stability for their spine when they're lifting something heavy. Okay? You know, remember, the inner core is controlling shear forces, so if I'm going to lift a barbell, I don't want my big muscles shearing my spine as I come up. Okay? I don't want myself going into this massive extension and doing that for 10 years and ending up with a back problem or making my current hyper-lordotic problem worse. I've got to make sure that my core is working before I start lifting heavy. And this is the hard thing, is getting, you know, breaking people down saying you can only lift a 10 kilo bar today, even though they're strong and their back's strong, but you're trying to change their motor control and their pattern of movement. So when they go heavier, they don't go back into their compensation pattern. They maintain their good pattern that they've built up. And match the load level to the task. You know, you're working on breathing work on the floor, like mat work, and making sure you get them up to a certain percentage of how they're going. Well, that's fine for breathing and that sort of thing, but if you're going to start lifting something, you're going to have to make sure that they can actually increase that specific to the load. All right? So when you're sleeping, the breathing is very light. When you're going to lifting deadlift of 50 kilos, 100 kilos, it's going to be a lot different. Making sure when you're teaching these things, if you're good at teaching pelvic floor and breathing work and getting their transversus working, the multifidus working, you transition that into the exercise. Don't just do the exercise on the floor and then forget about it when they're doing a deadlift. It's got to transition all the way through. And that'll give you that optimal stability. And just watch for those brace patterns. As soon as the weight gets heavier, they'll start going, too hard, brace. And then you are promoting the original problem. Okay? It's very hard to stop these people going heavy. But if that's the secret. If you can slowly move them up and teach them and keep them on board for long enough, you'll do really well with them. And like I said, if you're struggling with the training specifics, get them to see someone who knows about the low activation, learn that, and then move that into your gym routine or your sport routine. Okay, glutes. Very, very important. The prone glute sling. Now, again, this is on our website. What you've got to work on with this one, hopefully you can see me here, is we're trying to get activation of the glute and make sure that when we use the glute and extend the leg, we don't go into lumbar extension. Okay? So, secret with this one, if you guys want to stand up, just stand up. When they're on the floor, you try and aim for, when they're lying like this and they're hyper-lordotic, they're going to be in extension, which you don't want. You want them in neutral. So most of the time what we get them doing is trying to get there, if you watch my pelvis, trying to get them back into neutral. So they have to do a posterior tilt, use their glutes, get very aware of them, guide them into it, tell them to hold it there. And what that does is takes the pressure off your lower back, switches on your transversus and everything in multifidus because you're back into neutral. But then you've got to try and clench your buttock and raise your leg. And most people, when they first do it, they'll go straight into extension because that's their pattern they're used to. And the load of the leg is too much for the activation that they've got in their brain, so they go, I'll use my back to try and hold myself up. So they've got to be posterior tilt, and then they've got to try and work out how to clench one buttock, hold it there, keep that leg straight, and slowly lift that off the floor without losing their neutral. And then they've got to hold it there for about half a minute, which is actually really, really hard to do. And I suggest that you guys, with everything that we do here today, you practice that and you get good at it, because if you can't do it, then there's no way you can tell your client how to do it. All right? And that's one of the very difficult exercises, but a very, very good activation exercise that you should do straight in at the start of your exercise routine to make sure that they know how to hold neutral under a little bit of load. Okay? And it will teach them a lot of good things. They'll do, 10 sets of 30 seconds. They'll get up and they'll really know where their neutral is. It just switches everything on. It lights all the little neurons in the brain, and I can really hold that there now. Okay, and that's your posture you need to hold all day, then, John. Oh, right. Yep. Okay. Good. Yep. Rather than this sort of thing. Okay. So simple exercise like that, you teach, you learn, and then tell them to make sure that that's the posture we want. Glute bridges. They're a little bit different to what you see in Pilates, okay? And remember, we definitely don't want people extending, because that's our problem, okay? We want people to be able to make sure they can hip extend, because that's what you're doing when you're doing squats and deadlifts, is hip extension, not back extension. So we want to promote, if we're going to get people squatting, before we do that, okay, teach them where their neutral is. And the trick with this is, you've got to push down through your heels. Okay? And when they push down through their heels, then they clench their buttocks, then they've got that pre-activation, and they've got to just increase that and keep neutral here without extending. So they're actually doing hip extension, and their back is just sitting there at a low level, just doing stabilization, rather than that. Okay? So they work their hamstrings as well, but the focus is on getting their glutes, helping the tilt, because their hamstrings are so weak. They'll probably find their hamstrings don't work. Some people get doing this and they cramp in their hamstrings because the brain goes, I don't know what I'm doing. That's too hard. and they use the wrong pattern of movement. So you have to break it down, just doing little lifts, and stop the cramping, get them really contracting and getting so focused on how they control that neutral. Because that's so important. If they learn those two things, they get down to skydives and lunges, then they go into deadlift, they're really aware of what's happening. And over a long period of time, it's awesome for them. Skydives, we call them skydives because you look like you're jumping out of a plane. This one, again, is taking an exercise that you've probably seen before and correcting it. So you see people doing this, okay, for back extension because they think their back's weak. And yes, granted, it does increase their, lumbar extensors, but we don't want that because that's not the problem we're trying to correct. We want to be able to get them lifting their back with their legs. Okay? So again, I've got to try and find my neutral. So I don't want to extend, because otherwise my bum's doing nothing. I've got to actually contract, pre-contract here, my hamstrings and my glutes, and then pull myself up by doing hip extension and keeping my back in neutral. My back's on, I can feel it, but it's not doing massive extension. Okay? The extension's coming from my hip. All right? And that's getting those legs, hamstrings, glutes working, teaching the body to use the big limb muscles to move the body and the core muscles to give that stabilization and movement, not the big core muscles to try and move the spine, wrench it around. Because under load, when you're doing weight training, you've got to remain reasonably stable. When you're playing sport, you've got to move. But we're talking about the strengthening side of things to get these certain problems stronger. You have to do some sort of stability work with that. Skydives is so important. And when you're doing this, do it in that order. Do it in that order. Great way of activating through the chain. Now, Physio Lunges, we'll talk about Physio Lunges tomorrow as well. And my knee one, my ACL seminar. The Physio Lunges are completely different to normal lunges. I've just coined them Physio Lunges. I was going to call them Keeley Lunges, but we'll just call them Physio Lunges. These ones, when you're doing a lunge, normal lunge, pump class, walking lunges, you're going straight down, straight up. Okay, both legs the same. Works a lot on quads. Works the legs, keeps the spine nice and straight. But unfortunately with these people, they are in lordosis. They find it very hard at this point because of their tight hip flexor to maintain that neutral. Okay? So what we want to do, and this is very good for anyone who's lacking glute control and VMO control, is actually move them forward. So their back can stay flat, all right? And it takes the load off the back knee. If anyone's got patellofemoral problems, they're going to hate these lunges because it loads up the patellofemoral joint. If you move forward and keep the weight over the front knee, you'll put compression through the knee joint, which it likes. It doesn't like shearing forces. It likes compression forces. It takes the pressure off the patellofemoral joint and puts it through the front of the knee joint. Now, the secret with this is a lot of people say, well, how far is my knee supposed to go forward? Okay? Well, it only goes as far forward as the angle of the tibia stays the same as the angle of the back. So I can't push it forward and do that. Okay? I also can't do this because I'm not doing anything for my leg. So it needs to stay, hopefully, I haven't got a mirror, but hopefully this will look all right, stays the same. And my back leg, my back thigh is the same as my shin, the same as my back. Okay? And the more hip flexion I get, the more hip flexion I get, I'm going to activate my glute max more, which is going to help me with my neutral control. Because glute max, very complex muscle, it works more in flexion. When the hip goes into flexion, it pre-fires more, and quick movement pre-fires more. So sprinting, upstairs, that sort of thing. So working in this position is not going to fire it very well. You've really got to get forward. And the secret with this, again, put that weight down through the heels. So many times people lift their toe and, oh, my knee hurts, because they're shifting the weight through into the patellofemoral joint. So make sure there's a lot of components to these Physio Lunges. It's actually quite difficult, but if you go on my website, there's a really good video on it. Put the weight down through the heel, get those angles correct, keep that spine in neutral, get that hip flexion, And when they're down there and their bum's screaming, which is great, okay, better than their back screaming, they've really got to think about pushing through their heel and using their glute. Now, there's sort of two ways to do it. You can actually push back to 50-50, or if you get more advanced with it and you can tolerate some strength, you just push straight up and then down and push straight up. And trust me, they get 3 reps, or 3 sets of 12 of that, they're going to start really feeling it through there. Okay, fantastic exercise. You don't need weights with it, but when you progress, start using bands. You know, you see so many people that lunge like this, okay, especially traveling lunges, where their controls all over the shop, you know, doing this sort of thing. And even if they keep their knees straight, watch what their hip is doing on the other side. I see so many people, they do this and drop on one side, and they don't know what they're doing. If you look at it from the back, they've got to remain level, otherwise, what's not working? Glute med, glute min is not switching on. Then they'll have problems still when they try and run, because they'll do that. Okay, so making sure that their lateral control is correct as well. And if they struggle with knowing how to control that, tie a band around from that angle, they've got to fight that band, switches them on more. When they go into flexion, they'll get a better workout in their buttock. Okay. Does that all make sense? Hammies. Love hamstrings. Used to hate them. Why did I hate them? Because they were weak. Didn't like doing them. People don't like doing stuff that they're not good at. Now, we're not talking about stiff-legged deadlifts. We're not talking about full deadlifts. We're talking about Romanian deadlifts, what I just call to patients hamstring deadlifts because it makes more sense to them. The Romanian deadlift, and I've got a video. Have I got a video? No, I haven't got a video on this one. We'll use a nice light bar today. The Romanian deadlift, remember these like hyper-lordotic people, as soon as they grab a bar and the stand, they're going to do that. But hopefully you've done all those glute exercises. So they go, now put yourself back in neutral using your glutes. They go, oh, yep, I know what I'm doing. What's going to switch on? Here, because you need this transversus multifidus working because the load's going to go on the spine. You need the spine protected. All right? But we're trying to isolate the hamstrings. And it's a very good way of isolating. It's a very difficult way, but it's so functional for people. Picking up things, picking up babies, picking up washing. Okay, it's very, very functional for them. If you can teach it and they get strong at it, then hopefully it's going to translate into their everyday living activities and they start getting problems. So with this one, you've got to make sure, again, try and keep the bias on the heels a little bit more than the toes. From the toes, they're going to go that way. Heels, they're more likely to maintain a good neutral posture. And remember, your center of gravity's got to go through your ankle. All right, my plumb line. So it makes more sense to keep the weight down through the ankles, through the heels. A little bit of a bend on the knee. Get that neutral and make sure that everything else is correct. And you've got to teach them this quite a lot. So when they go on deadlift, they've got to keep their lower back in what I call no man's land. It's not an extension, and it's not an flexion. It's that halfway in between. But as soon as people go like this, they're either going to go that way or they're going to go, oh, do that. And they stick their bum out because they're not sure of how to stabilize here and bend to that point. Because every time they've been picking up the washing, they bend at that point. Okay, and they let their hammies go. They're not bending at this too much. So now you're trying to teach them, no, you've got to bend at your hip, not at your back, which is very difficult for them. So that's why it's got to be light. This feels like about 7 kilos. So in here, making sure, and when they're down, they look at the floor. They're not here. Okay, and when they come up, they've got to actually push through their heels and fuse their buttocks and thrust their pelvis forward. So many people do so well to here, yep, and then they'll go like that, which is again is promoting that extension. And trust me, it's hard, and you guys have got to practice this in front of the mirror, get a colleague to help you with it, making sure that that neutral stays neutral the whole way, and you don't try and go and stick your bum out. Okay? So, making sure you work on that. Prone hamstring curls, I actually videoed for you guys because this happens a lot in the gym, and we don't have a prone hamstring curl machine. Now, prone hamstring curls are great. Okay? I used to hate them because I was weak at them. Okay? And when you come out of physio school, everything that's a machine in a gym is forbidden. Whereas when you work in a gym for long enough, it's actually fine. It's very, very, very good. So, prone hamstring curls. I'm going to show you the video, which my colleague has videoed for me. The first two is what you don't want to do. Can you see my back's gone to extension and my head's gone to extension? If you watch this again, how many times do you see that in the gym? And the load's too much. This plate is on 1. And then I've kept my spine neutral. And you see how hard it is for me to... I slow it down as I come up because I know I'm going to sort of go into extension. I have to reset, keep my neutral and try and I'd still do a little extension, but I'm not doing a massive amount of extension. Okay, and that's just my first set. Now, again, you can see you can do 2 up, 1 down. Is a very good way of increasing the hamstring load. So usually the weight in these machines, see it's on 1 pin. And I'm not saying weak, but that's actually quite hard. Because you're actually controlling, you're trying to get the hamstring doing a movement of helping and the buttock helping to keep neutral and bending the knee. Because that's what it should be doing. If I just pause that there. When you go this hip here, the hamstring is supposed to extend the hip and bend the knee. And then its majority of function is eccentric control. Now, if I bend my knee, which is shortening the fibers here, if I go then and let my pelvis go that way, what's going to happen to the top of the hamstring? It's going to lengthen. So I'm going to get a tearing effect. So if I try and pull it, shorten at one end and lengthen the other, the hamstring is not really going to strengthen up, is it? All right? Now, some people do very heavy these things and get really big hamstrings, but their posture is shocking. And for some people, their posture is fine. You probably find they're quite stable. People who are hyper-lordotic have problems and have to lighten the load. And the secret of the strength of the hamstring is to get it activating and working correctly. They'll feel instantly stronger because it's working, and then they build their strength. Yeah. Sorry, so to go into the... Yep. Yeah, so this one here is for just getting their strength better. Okay, so whereas a deadlift was getting that functional movement pattern correct and helping with that, this is another tool to just work directly on hamstring strength to help with that functional pattern. The stronger those hamstrings are, the better that functional movement, the better component you've got in your hamstring to do the movement. So this is more of an isolation thing, but you can still see you're working very hard on trying to keep neutral with this, so it has got that functional component to it. Okay? Making sure you use that glutes with that. That's great. Okay. Single leg deadlift. So if someone's got a problem on one side more than the other, and we'll come to this in SIJ problems. So again, they just have to work on getting their stability right. They probably find this is a lot easier to maintain neutral, but a lot harder to keep that wobbly knee in line. And as they drop down, they'll tend to do this. Okay, they can't keep it sorted. So that's where they've got to work on their glutes a little bit more. But very good for one-legged work. Again, making sure that they get their leg back enough. If they go to here, they tend to round. All right, so they've got to get that leg straight and keep their back straight. And when they come up, they can't extend their lumbar spine. They've got to try and use their leg and get hip extension. Okay? And then moving to the TRX, you see people doing in the TRX straps doing supine hamstring curls, very, very good. Or using a ball is another way of doing it. And then using the hip extension machine, the forbidden machine by all physios. And we see it so many times, people use it as, we'll get on the back machine. Now, yes, it will strengthen up your lumbar extensors, but that is not the goal for these people. The goal is to get hamstring and hip. So again, I'll show you a video. Now, this actually takes, when you're on it, you get on it, you think, yeah, I'm all right, until your colleague tells you that you're doing it wrong. So you've got to make sure that you've got someone helping you, and you guys, personal trainers, you've got to see what people are doing wrong. And you'll see on the first couple, I'm doing it wrong for you. And then the fourth, fifth, and sixth, so by the sixth one, I finally got it right. Okay? So, I'm in too much extension. As I drop down, I'll go into flexion, that's fine, but if I come up, you see I'm just doing a lot more extension of the lumbar spine than I am doing of my hip. Okay? And that's just promoting that movement. So this is my first attempt. So if you watch my pelvis, I'm trying to keep, sort of got it right, half right, too much extension, that one. Head wasn't quite right. Do it again. And the more you think about it, the more awareness you've got of that motor control, the better you get at it. Oops, head's not quite right. Hopefully the last one's the best one. And if you watch my lower back, I try and maintain my neutral as much as I can. Okay? This is a hard exercise. But if your clients are doing it, you've got to do it correctly. If they're not doing it correctly, pull them out of it. But it's a very, very good way of actually getting a high level hamstring load strength that is reasonably functional because they're doing a lifting pattern movement. Okay? But they've got to have all the other components done first. They've got to have their glutes component. They've got to strengthen up their hamstrings first before they even try and do this. Don't do this as your first exercise because it's just going to be too hard for the person. Okay? But you see how the technique and the instruction is so important. You can get some really good benefits out of these exercises if you do them right. But it doesn't take much to do them wrong. It doesn't take much. Do's and don'ts for this section. Remember, it's not the lumbar spine most of the time that needs strength, as in the extensors and your QL and things. They've got big lumbar muscles here. Maybe their multifidus and transversus is not working, so you've got to work on their core. Their hamstrings are not short. They may feel tight because they're at length all the time and they're under tension all the time, but they're not short, so you don't go and strict them for length. Maintain neutral is the most important. These people are the ones that stand at rock concerts like this, and they get through an hour and go, oh my God, I want to go home because my back is wrecked. So the more they stand with neutral, the longer they're going to be able to stand for. But you can't hold yourself neutral just with your abdominals. You need the other muscles here to act as guy ropes. It's very hard to try and hold yourself just with your abdominals because you're going to brace too much. You need your big muscles there balanced. If your muscles and your legs are balanced and hold you like a guy rope like that, it's very easy to hold yourself in neutral. And that's what normal people feel like who've got normal posture can go, what are you talking about? I can stand all day. Because they've just got their balance correct. So watch for the extension activity on everything you do. Watch for them going into extension. Watch too much activation. That's the rule. Because if you try and overload the exercise, you're going to compensate. They're going to go directly back into that pattern. So it is one of those boring things where you have to start low and progress them up very slowly. And make sure they stretch. There's a big component of stretching because they'll do those exercises for you. Wake up in the morning and go, my back's sore. Because they forgot to stretch. Because it's all tightened up on them. And they do that again. Okay? So make sure that they stretch. Good? Yep.
We were talking about butt grippers yesterday. What's the difference between
About
butt gripper and not...
Oh, a gripper, a butt gripper. Yep. So these people aren't butt grippers. Okay? They don't hold themselves that way because they're in that position.
But what's the difference between activating glutes and gripping butt? Is it the same?
Well, the activation is when you're doing the movement. Okay, so you're trying to get them activating so they know what to do when they do the movement. You're not trying to hold the buttocks on all day like that. Okay, activation, so it's being aware of that muscle contracting rather than going letting the muscle do nothing. Being aware of how to switch that muscle on when they go into a movement.
So you don't teach them to tap under?
You don't teach them to hold themselves like this all day. No, they've got to get the muscles strong enough so they don't have to do that. So the muscles naturally just sit there holding at that low level rather than that high level of butt gripping. Okay? Right, we better keep moving. So, disc bulge. How many people in here have had a disc bulge or herniation? Okay, cool. You'll love this section. How many people of your clients have had a disc bulge or herniation? A lot more. Right. So, classic. People with pain and bending, sitting, and lifting. A little bit opposite to the ones we talked about before. Remember, your hyper-lordotic people, unless they've got a bit of a fasciate joint jam, that's sort of an injury, they don't really have much of an injury. That's a dysfunction. These people have a full-blown injury. All right? So they sit down for a long period of time, they get pain in their lower back or down their leg, whatever symptoms they've got. They bend forward, oh, God, that's no good. Okay? And sometimes they can't bend backwards either when it's an acute episode. They're lifting. After lifting, they'll move the house, they'll move the cupboard around the feng shui of the room. The back wrecks, the back's sore. Usually these people got referred pain and symptoms if they've got a prolapse here where the annulus is torn and the disc material is coming out. It's going to put pressure and chemical stimuli, nociceptive stimuli on that spinal cord, which gives them broad-based pain. They'll get compression here. They might get pain or pins and needles or numbness or motor loss or all of the above. Right? People who've had this for a long period of time can get foot drop, and that's more of a surgical option. The mechanism of injury is usually an episode of bending forward. Whether they've been sitting beforehand and they get up, they're still bending forward most of the time. And if anyone went to my lecture last year on disc prolapse, you'll understand what happens. We're not going to go too much on that. But as you bend forward, you can migrate the fluid into the back of the disc. The more times you do that, the more pressure builds up. This stresses this annulus around the back. It gets weaker. It starts cracking and fissuring. There might be the first episode of pain. They bend forward one more time and dry their hair and do that. And it ruptures, like my wife's did. So what happens? They lose extension. So these are the people if it's acute episode, they've got to be at the physio. Okay? But if they've had it down the track, 6 months ago, I had a disc bulge, it came right, pretty good, I feel a bit weak in my back and I need to get it stronger. These people, if they're like this, they still need treatment. Okay? You need to be able to restore that extension before they start doing any strengthening work. So they usually have lost extension, whereas hyper-lordotic, like me, can go, I've got heaps of range, there's nothing wrong with me. Well, I don't have a disc problem. Most disc problems that are posterior, they'll, God, that's stiff. Can't go back. And if they're acute, when they go forward, they'll have pain and spasm and affection. They'll come forward. Oh, jeepers, no, I can't go forward further than that. It's pulling down my leg. All right? Again, these people, massive core shutdown. Because they're an injury rather than a dysfunction, the messaging that's going through the spinal cord, that reflex inhibition is a lot greater. Okay, there's more chemical stimuli. You're going to get a lot more atrophy of your little stabilizers and a lot more core shutdown and bracing. And these people, before I forget, need a lumbar support when they're sitting. And I'll get you guys all to stand up now because those people with back pain probably feel like they want to stand up, so just stand up for me. Those in the class, hands on hips. I want you all to bend backwards. The people who have no pain can sit down. So I want you to go all the way back. If you've got no pain, no stiffness, then you can sit down. Right, that's about half the class. The rest of you have to do 10 of those, and then you can sit down. All right. These people need to stand up more often. They need to do extensions more often times during the day. You'll probably find by the 10th one it's feeling a little bit better. If it's feeling worse, you probably need to come and see me, and we'll see you on Monday. All right. So, what are you going to do? Restore that lumbar extension range of movement. Physios all know that. McKenzie physios know that to a T. These people, they lose extension. What are you going to do? Get it back. Okay? Push that reset button. They've got to constantly work on it. And every day it's going to tighten up on them. Just like my posture here tightens up on me, these people lose their extension. So you've got to keep working on it. It's not saying you do it for a little bit in physio and then, right, never forget. It is a lifetime stretch. You have to keep doing it. And the problem with this one is people forget because they'll go through periods of no pain and they won't do extensions for 4 weeks. Then all of a sudden they wake up and their back's sore again. And then have to spend all this time extending in because what's happened is the disc pressure is slowly increased again and they don't feel it until it's a little bit too late. So it's something that's like fitness. If you stop running or stop exercising, you're going to lose your fitness. If you stop doing extensions with this problem, you're going to lose your extension and your problem is going to come back. Activate the inner core. We talked about TA multifidus, pelvic floor. They've got to get that going. Remember, that's very shut down. It's very similar to a pregnant woman. People who've had childbirth, similar sort of shutdown because the disruption to that reflex is very similar. They need a lot of postural support and education. They need to be told to stand up. They need to be told to walk to the water filter and get some glass of water because they'll go to the toilet more often because that will make them stand up more instead of sitting for 8 hours a day. They need those lumbar supports. And the more this goes on, the more they learn to hold their posture. But you've got to keep them on board. And remember, a lot of the time if they're weak, they can't hold their posture up. So you do have to strengthen these people. And there's studies showing that if you strengthen and load up the spine to a little level, it actually strengthens the annulus. It's a ligament like any other ligament. It's just got a few more other crazy functions. But if it gets torn and it gets weak, you have to strengthen it. It's like an ankle. You've got to strengthen it. So strengthening for the back is good. You've just got to be very careful about it. Teach them correct lifting and bending techniques. Okay, they can't go and pick things out of the car and do the gardening for 4 hours that they used to. They've got to change their spinal position. They've got to get good and learn what positions they've got to adopt, keeping their neutral, not bending forward too much, not sitting down too much. And that's a lifetime thing. And it requires a lot of education, and sometimes it's very easy just to send them to the physio to tell them this is what you've got to do, but then you guys as trainers have then got to take that on board and keep that going. Otherwise they'll think they don't have to do that anymore. And it's a gradual strengthening program. It's a lot more gradual than doing what I was doing before. It's a very long, slow process, and it's very hard for these people. So you guys who have got people with disc problems really have to focus on making sure that this program is very gradual. Okay? And, complex situations like someone who has a disc prolapse and then gets pregnant. They haven't got time to strengthen up very well. They do as much as they can, and hopefully throughout that time you guys can keep them exercising and keep their muscles working. They have to just work on low-level stuff because they can't work on the heavy stuff because they're pregnant. And then after pregnancy, when they lose their core stability, what's going to happen to their disc? So the emphasis is on making sure their spine is stable and doing as much low-level work to keep things working and activating, and making sure they don't do too hard of stuff, and making sure they don't do vacuuming. They don't bend forward in the dishwasher too many times a day. I'm teaching them which positions to avoid. All right? So, key stretches. McKenzie extension, this one here. Making sure you're aiming to get those hips on the ground. Okay, you're not trying to stretch out your hip flexors with this one. So when they are, you'll probably find the first time with the people who are stiff in the class, your extension's not so good when you bend backwards. It's not going to be so good here either, but you're unloaded in this position. So we'd rather you did it in this position because there's less pressure on your lower discs. And you'll find they get up to about here and go, oh, and down again. And then, oh, goodness me. And they've got to do 10 of them, and then 20 of them, and then 30 of them, and they might get up to about here. They go, right, that's better. And then they'll stand up. They go, oh, yeah, that's a bit better. And then they have to do, only going to the pain, not into it. They go up to the point where they're tight, nearly painful, and then back off. And as that barrier increases, you go with it. Don't go into the pain with this one because you're going to start causing problems. Yep? But this needs to be done every hour on the hour if they're acute. If they're not so acute, they just do it as many times as they can. Some people have to sit all day. Well, try and find a room in the office where you can lie down. Okay, they've got to make changes to their lifestyle. Lumbar rotation. This one here, old footy stretch. Okay, but it's not just, oh, yep, click, click. Oh, yep, good, right, finished. It's a minute stretch. So you've got to hold them into lumbar rotation for a minute because you'll get some creep in the disc material. Okay, that centrifugal force will actually help even out the pressure inside. Because remember, the pressure is incorrect. It's too much at the back. So you'll even that out a little bit more. That's a fantastic stretch to do in combination with your extensions. Mix it up a little bit. Then you move into glutes, because they're usually holding on with their glutes because they don't want to bend forward, butt grippers. Okay? Or if their glutes are very, very weak, they'll probably be tight as well. Some people they aren't. Some people they're very floppy. Yep. No, relax. Yep. Let everything go. Because they try and switch on, they're not going to get the range that they need. Remember, it's a stretch, it's not an activation exercise.
And with the lumbar rotation, do you just allow them to use the weight of the leg to hold it down?
Yeah, if they can't go too far, maybe put their leg over onto a pillow, or use 2 legs over. But watch these people, because you do move into a little bit of flexion with these people. So sometimes, especially the physios will know in the class, if you go a very acute person, put them straight over, they're going to probably punch you in the face. So you've got to be very careful about how quickly you move. Hopefully you guys, you train them, they've had an old disc problem, or they've had some treatment, so you're not going to run into that situation. If you do, refer it on. Hamstrings, okay, stretch the hamstrings, they'll get relief from that, especially if they've got some sciatic tension going on. But be careful that when you stretch hamstrings, you're not going to lumbar flexion. So when they stretch their hamstrings, this really needs to be high, but when they stretch their hamstrings, you've got to make sure that they don't go and do that. Because what am I doing? Lumbar flexion, they'll get up and go, oh, geez, that wasn't too good. Because they've got to hold the stretch for 60 seconds. So what you're trying to aim for is keep them in neutral. And then do extension here. And they go, oh, yeah, I feel them hamstring now, and their back's fine. They can even be in that position. A little bit of extension, okay, because they're trying to stretch their hamstring out. And then they get relief from that. The hamstring lets go a little bit more, lets go of their sciatic nerve a little bit more, and they find that, oh, that feels a bit better. Okay, so hamstring stretches are great. And neural stretching, or neural mobilization, like the physios know, is very important. If the person needs that, you need to learn how to do that, like neural flossing, to help that person. Because if they've got to do it, they can only see the physio once a week or something, because they're seeing you 3 times a week, and they're financially, they really want to focus on their training, then you guys have got to do it. So, strengthening. So remember, these people, their core is going to be like a rotten apple core. So it's not going to be as good as the people who are hyper-lordotic. They're going to have a lot more problems with that. You're going to have to spend more time on it. And remember, when you think of core, don't just think of planks. Think of all the things before that. Work on their pelvic floor, get their breathing right, get their transversus and multifidus working. Okay? Knee fallouts is a very good exercise to control their rotational movement, very good Pilates exercise. Heel slides, leg lifts, all those sort of things challenge the body to try and hold neutral and challenge that core strengthening, so you get slowly more aware, better motor control, a little bit more strength over time. The arm leg raises, again, you've got to be very careful that you don't load them up. And if you're doing this one for hyper-lordotic people, making sure that when they do their arm leg raises, they're in neutral, not extension, okay? And when they're in neutral and then you try and raise their arm leg, they don't go into extension, okay? And make sure they're in scapular protraction and head neutral. So you can't sit them down like this, because that's part of that complex system. If the scapula's not on, they're not going to learn that whole body function very well. So you've got to make sure that they're in their neutral, they're in that nice protracted, serratus anterior is activated, and when they raise one arm leg, they're not going to shift off one side more than the other. So if they're in this position, you don't want to sort of go, and think you're doing it correctly. I'd rather you didn't even raise your arm or your leg to try and keep yourself neutral. So if they're in this position here, you almost like just shift all your weight onto one, and if you can't lift it without moving, don't lift it, because you're still doing some great work through there. The aim is not to lift it. The aim is to try and keep your body in neutral, okay, and teach your core to work under a little bit of load so you get that strengthening going. And if you can raise your arm, you've got that there, and then you can try and raise your leg, okay, and that's too hard. So go onto a flatter surface.
So is your neutral in that still like a 3-point downward?
Yep, exactly. Use one of these. If they don't know where they are, get a mirror and have them look at a mirror, get that dowel rod and get that spine all hitting those points. Yep, fantastic thing to work on. Okay, so, and planks is a safe exercise. No crunches. Why don't we do crunches? Flexion and too much intra-abdominal pressure and too much activation of my outer core. Okay, my obliques, my rectus, okay, muscles, and there's a lot of shearing forces. Remember, when I go into flexion, the big muscles that move the spine and the core, the big core muscles that move the spine, my hip flexors that move the spine. Remember, the hip flexors are attach onto your lumbar vertebrae. So when you do a sit-up, and most people do it badly, they'll hinge at their hip flexor up into here, and they do hip flexion. And that's pulling on the spine. So you're getting a lot of shearing forces. And if your core, your multifidus, and your transversus, and your diaphragm, your pelvic is not up to speed, then it just won't be able to give that nice stabilization through movement, and you'll get big shearing forces, and they'll start breaking down. But planks is a great way of strengthening outer core, but keeping neutral. Side planks, atomic push-ups, whatever you want to do. Yes. Well, if you can do it for a minute, then that's pretty standard. A lot of people can't. They should work on it until they can do it for a minute. Oh, you'll just fatigue too much. So when they go into plank, they'll just their core will start going, their back will start increasing, and then they'll start winding up. So you don't want to go so long that they're shaking and all sort of thing, because they'll start using compensation patterns that are against what we're trying to do. Yep. So you better be on the knees for a bit. If they can do 10 seconds, then build. Your aim is for 60. How long is that going to take you? It depends on the individual. Yep. Yeah. Well, no. When they do... Sorry, say it again. Crunches for these people? No. I'd get rid of it completely. You can do crunches for me, my hyper-lordotic, because I need my rectus abdominis a little bit stronger. Don't do crunches, or in my mind, in my opinion, don't ever do crunches ever again with people with disc problems. It's not worth it. But they're not. They're going into flexion. They're going to loaded flexion, which we don't want for these people. Okay? Unloaded flexion is sometimes okay. You know, I need to pick up that. I've got an old disc problem. That's going to be okay. I did it once. It's no worries. When you do a sit-up, it's loaded. It's like picking up a heavy weight. So I would get rid of that. Yep. It's like a ligament, so it does repair itself, but it is a degenerative structure. Okay? So the annulus will repair itself and scar itself up, but it's not that great. And when you look on a scan, it's all looking black and they've lost fluid. The biggest thing about this is it'll scar, but it's like a sort of a tire that's been patched up. It's not going to go at 100 miles an hour anymore. And the inside of the disc, you don't have that hydrostatic mechanism very good anymore. So your ability to load is not as good. The body knows that. It tightens it up. So strength essentials. Thinking about gluteals and hamstrings as well. All right? Making sure you go through those gluteal and hamstring exercises. They do need strength on that. But we're not going to do Romanian deadlifts. Why? Because it's loaded. I do teach under very strict guidance a Romanian deadlift movement pattern because that is essential for daily life. Okay? I don't want my people going into the car and picking up the pram like that. I want them to be able to use their hamstrings and their glutes to pick up the pram. Okay? But I don't want them doing 50-kilo deadlifts because it's going to be too much load for them. Right? The golden rule with most people with disc problems is never go over your body weight in squats or deadlifts. Now that's the top end. All right? Don't use that as your rule for, oh, yep, you'll be right. We can go up to 80 kilos on you. Okay? I would try and avoid the Romanian deadlift and heavy squatting, heavy lifting as much as you can because it's just not going to work out well for you. Light is going to work out well because the light strengthens you up to a point where they're functional and they're working. But if these people have had a massive disc prolapse, they're not going to be able to lift again heavy anymore. They've had changes in their spine, which is going to be permanent. Some good, some minimal. Some people do have disc problems and they still lift 80 kilos, 100 kilos. But for you guys, safety and as a guideline, try and not go there. Kettlebell swings. Yeah. Loaded flexion. Even if they maintain neutral and have good glutes and good hamstrings, it's still loaded weight, Newton force through the posterior part of the disc. If that disc is not as strong as it used to be, they're more likely to have a recurrence. You don't want to be that person who creates that. Heavy axial loading. What does axial loading mean? Down through the head. So that means like the heavy squats. That's axial loading. Shoulder press is axial loading. Okay, you've got to really start thinking about these sort of things. Carrying boxes and putting up in shelves. Heavy things, they'll need a hand. And just watching those incorrect spinal positions like lifting and bending. Yes? I do lunges with weights. Yep. Okay, hand weights. The hand weights, if you have the hand weight here, it'll transmit the force to the arm. You take it up in the arm rather than straight down through the spine. Okay, rather than having it here. But it is hard. These people don't do heavy weights anymore. Heavy. Okay, they've got to build up to that, and it takes a long time. So they do body weight stuff. We better keep moving. So correct the lifting patterns. Sumo squats, front squats, and I said like their deadlift technique. Okay, the front squats. This is me going heavy. Well, it's not that heavy. It's only 40 kilos. But what you've got to make sure of when you're doing a bar squat, you've got to teach them how to squat because they have to do that in everyday life. With this one, you can see that I can't remember which one this is. Let me just have another look. That's a reasonably good one. Now, the reasonably bad one, so I get this right. Is lumbar flexion. Did you see that? What do you think is going to happen to that L5S1 disc when I put 40 kilos on it and it does that? Is it like doing this? And they're doing 3 sets of 10, 3 times a week? Okay, so that's the thing you've got to be aware of. They've got to maintain neutral and it's got to be light. This one, I think, is more... That's the good one. Yeah, so maintaining neutral all the way. And they're only allowed to go down as far as they can control neutral. If that's 45 degrees, that's 45 degrees until they can get lower. Most people who go past 90 will actually start rounding their spine. That is fine for people squatting down, doing things, that's fine, but not under load. Yep. So you can squat down to the floor if you're going to pick up a bit of paper, but you can't do it when you're training under load. Making sure their function and their bulk. You know, you've got people who want to get big. Well, they're probably not going to anymore. And trying to get these people fitter. You know, their goal is fitness and being able to do activity rather than let's see how strong I can be. You do have to get them stronger, but try and think about fitness as your goal. I'll answer the questions at the end because I'm running out of time. So gradual return to normal fitness routine and slowly build that spinal core strength. Watch for the loss of neutral. So important when they go down. If they go into flexion, they're going to start causing problems over time. Avoid the axial loading rule. Postural life changes. Watching that intra-abdominal pressure with things like crunches, that sort of thing. And then our last one, SIJ. Okay, little short segment on this one. If you really want to learn about SIJ, especially the physios of how to treat it, go do Barbara Hungerford's course. These ones usually have that pain right there, but they all can also have different pains and pelvic pains in other areas as well, depending on the dysfunction. It's usually pain on weight bearing on one leg, and it's usually one-sided. Hypermobile people, it's very common in because their joints are a little bit looser and they're susceptible to a lot more shearing forces because they don't have as much stabilization through the pelvis and the hip. Their TA multifidus is the delayed firing, so they don't get that core working very well. They can start having rotation through their pelvis. They start having tilts. They start having sacral torsion, where this sacrum actually is moved rather than the pelvis is moved. And the hips, they get really tight. They want to get their thumb into those glutes and get in there. Oh, can you just massage it? It's so sore. and that's where their pain is. Their glute max is not working. They have the floppy bum. That doesn't work. And usually every SIJ issue has a lumbar spine component. So one side of their spine will be tight. They might have stiffness or irritation through that spine. Sometimes they're a bit scoliotic as well. And, these guys, they've really got to work on their posterior slings. They've got to use, their lats and their scapular stabilization through that thoracolumbar fascial, through down into their glutes, into their hamstring, to help control, stabilize, and give that form closure to the joint. So what are you going to do? Restore that pelvic SIJ balance, okay? Work on your neutral mechanisms, work on all the things you've just learned about how to maintain neutral, all those great exercises on what to do for transversus and glutes and hamstrings, okay? Make sure their hip stabilizers are activated. So these guys have got to work quite hard on learning how to do one-legged step downs. So learning how to use their hamstrings, glutes, calf, core, glute max, and use hip stability here to stop them going down and let that knee roll in. Very difficult exercise. One-legged step downs. Have a check on our website. There's an example on our sheet with that. And trying to use posterior slings. One-on-one leg stuff is great. That prone glutes one is great. Lying on your front, pushing your hand down, trying to get that glute activated, learning how to form close that SI joint. And like we just did, think with these people, they've got to do more single leg strengthening than two leg strengthening. Don't think, I'll do some squats for the glutes. It's single leg stuff because they're lacking on that side. If you do two-legged stuff, they're not going to get the build up on one side more than the other. And that's what they need when they're walking, running, playing sport, that sort of thing. Okay? So stretch their glutes. Lateral rotators, piriformis, they love doing this stuff. This glute stretch here. Hip flexors are usually tight because they've lost some stability through their pelvis. Hamstrings are usually tight. Work on those things. And make sure they get their activation component correct. Great one to do is clams. Clams, you will have seen this before. Working on, it's a very small bench, working on this movement. You've seen that before, okay? But making sure they're doing it with the right muscles, okay? They're not doing it with their quad and their TFL. They've got to start working on their quadratus femoris, that deep little short muscle in the back there. They've got to use their piriformis and extent as well. Clench their buttock, get their glute max activated a slight bit. Holding it there for 30 seconds till it screams. And getting that muscle working and activating. So when they do their one-legged step downs, they go, oh God, I can really feel that. Okay, we'll use that muscle now. Oh, yep, got it. And they use that muscle when they are doing the next exercise. So making sure these people, they activate first before they start doing loaded up exercises. Otherwise, they're not going to get the activation. They're going to compensate or share through that side. Yep. Try and think, for activation, low level for a long period of time. Doing isometric strengthening rather than on, off, on, off, on, off, on, off, on, off. In the phasic muscles like your bicep want to go on, off, on, off. You don't train your biceps by doing this. You train them by doing that. Okay? Your core, okay, hip stabilized muscles work at a low level for a long period of time when you're doing certain movements. Okay? And other big muscles work on top. So you've got to make sure you train the muscle of how it operates. Arnie raises prone glute slings we've talked about. These ones are great, single leg deadlifts. Once they get to the level where they've got hip stabilization, they can learn how to control, they've got their core right. Okay, now let's start working on getting their hip extension better so you get the big muscles working well as well, so they can do their sport. The step downs we worked on, those lunges are fantastic. Get them doing those front foot physio lunges, working on that. Remember, they can't drop down. If you see that on people, you have to work on your activation. I'll answer your question in a sec. And then finally working to step up. Most people think, oh, well, I'll do step ups. That's the last thing you need to be doing. Because when people step up, that's actually a very hard exercise when you've got no glutes. Because the first thing you do is push off your back leg. The second thing you do is use your thigh, and then rolls in. Or you overuse your back. They've got to be able to stand there and almost have no weight through that back leg, and then push-up. You've got to have a lot of good control there to be able to do that. And with someone who's pain or SIJ issues, if they do it with no control, they're going to shear through that joint. They go, oh, that's not quite right. And they'll adopt compensation patterns. They won't learn the technique right. They won't get the activation. They won't get their problem better. So do's and don'ts. Correct your activation with the SIJ stuff. First, get their posture right, obviously. And it's stabilisation over power. There's no point doing really hard, this is what we do in anterior cruciate ligament in the end stage of the ligament where they're getting in here and going up and all sort of stuff. You don't want to be doing that until they've got all their stabilisation and strength working well. So when you think about aerobics classes, what are they doing? Okay? And if these people, and I come to physio training, I've got an aerobics class on Monday. Oh, okay, maybe we'll just pull you out of that and do something different. Think functional with these people and just don't return to that impact too early. Like running, long distance. They're probably better to do sprints, fire their glutes up with less impact than doing running, long distance. So, to summarise, when you've got pain and injury, try and seek your physio. Know when to refer. Physios need to know when they need to get their personal trainer into their room, teaching them the stuff. This is what the problem is. This is how I activate it. I want you to do this in your session, because there's no point in seeing the physio and then going to see the personal trainer and not doing the same thing. You've got to be doing the same thing. So you guys have got to talk to each other. Work with them, PTs get in that room. We get PTs in our physio clinic all the time because they refer clients. Say, come and have a look at this. Look at this. This is how I want you to do it. And the PTs love it. And the patients love it. Because now they've got two people looking after them. And they're more on board with that. And that's the secret. If their patient's on board, the client's on board, you'll do really well. If they're not on board, you're just talking to a brick wall. Making sure you guys continue those rehab exercises. Make them harder, make them stronger, make them more difficult, but put them into your routine. And get those clients really compliant. Making sure that they just keep doing it. If you and the physio and everyone else tells them this is the way, then everyone's speaking the same thing, they'll do it. If you're not saying it, then they may decide that they don't need to do it anymore and bridge that gap. So, guys, for those exercises in PDF form, go to our website, which is there. Right? There should be a form running around where you can fill in if you want to put your email on. Like I said, we're doing this as a workshop, one-on-ones, and getting you all involved and learning all those techniques. So if you want to know when that's coming up, put your name down on that sheet, or go to our Facebook page and like that page, and you'll get an update on when those events are happening. Okay? Thanks very much.